Hello, and thank you so much for joining us today. Welcome to Patients Rising University. This is our inaugural webinar, Managing Your Chronic Illness and Organizational Guide, and it's brought to you by Patients Rising. We are a national 501c3 nonprofit organization dedicated to providing support and education to people living with chronic and life-threatening illnesses. We work with patients to advocate for access to the treatments, innovations, and care they need. We were founded in 2015. We're based in Washington, D.C., and work with and on behalf of patients all over the country as they struggle with challenges of chronic illness while simultaneously trying to navigate our multifaceted and often extremely complex healthcare system. My name is Terry Wilcox. You got to give me just a minute. Sorry, I've got to get in my groove here. My name is Terry Wilcox. I'm your moderator for the evening, and I am the co-founder and executive director of Patients Rising and our 501c4 advocacy arm, Patients Rising Now. Tonight, I am joined by Debby Bitticks. Debby is an award-winning author, health and caregiving advocate, and an intergenerational expert. Having been a patient herself and a caregiver many times over, she has tremendous knowledge when it comes to organizing. I have known Debby for many years, and I'm excited for you to learn from her this evening. Welcome, Debby.
Thank you. Happy to be with you.
We are also joined by Carolanne Montelone, who is a business owner, writer, and like many of you, a professional patient. Carolanne was diagnosed in April of 2013 with gastroparesis and is feeding tube dependent, which means she requires constant care. This is one of our advocates here. She is one of our advocates here at Patients Rising, contributing regularly to our Voices of Value blog, and we are thrilled she is taking the time to share with you her knowledge this evening. Welcome, Carolanne.
Thank you so much for having me. Can't wait.
And last, but certainly not least, we are joined by Whitney Morrison. She is a principal financial advisor at LegalZoom. LegalZoom is one of our partners at Patients Rising. They have graciously allowed us to be their only advocacy partner in offering their life plan services as part of our sustaining memberships. She has an absolutely fantastic presentation for you, full of lots of information you can use. Welcome, Whitney.
Thanks so much. Looking forward to it.
Okay, as we get started here, we have a lot of content to cover, so I'll try to go quickly, but not too quickly. There are 4 modules that make up this course: the things you need to get organized, the information you need to organize, the team you need to connect and share with, and everyone's favorite part, keeping up with the finances. And so when you see this symbol here, it means there's more information available on our website, which is patientsrisingu.org. And lastly, if you're having trouble keeping up, please do not worry. We have worksheets you can download. There will be ample opportunity after this webinar for you to get the information again and even send us follow-up questions if you have them. So let's get started. We're going to start with section 1. We're going to alternate here in the section between Debby and Carolanne. They have a wealth of information to share with you this evening. Carolanne, let's start off with the tools that you need.
Okay, so I recommend that you keep a binder or a trapper keeper to store a notebook, folders, calendar, other things that you'll be needing. You can keep all of your medical files in there, keep different tabs and sections for different doctors that you go to. This will help keep you super organized and have all of your important information in one place, which is going to be super important if someone needs to advocate for you, or if you would like to just hand the binder over to your doctor. It allows things to be outlined and organized, and it'll save you a lot of time and hassle trying to get records and notes and all these different types of things when you're going to different doctors.
Thanks, Carolanne. So Debby, Debby has some great information on how we can maybe divide those binders up.
Terry, I think the first thing I wanted to share is just to remind all of us that we're all just one phone call away from becoming a patient or a caregiver. And the motto that I live by, and I really like to share with everyone, are Debby's 3 Gs, which is to get informed so you can learn everything about your diagnosis, to get organized, to reduce the stress and put you in control, and to get moving, to take action, to be your own best advocate. And I really do live by that motto. And I do recommend 4 binders, but the first one should definitely be your medical binder, and it should always go with you to all the doctors. And I think that you're giving out some really good information on maintaining the symptoms, the medicines and treatments, and your calendars and all the contact information in there.
Yes, before we move into the next binder sections, this is an example of one of the logs we'll have available for download or printing on our patientsrisingu.org website. And this is based on data capture concepts, which are used in clinical trials. So this is something that you could, download and use to track symptoms if it would be necessary, if it would be helpful for you in any way. And now, Debbie.
Okay, so I mentioned 4 binders. Well, the first one was medical, the second one is insurance. And one of the things I wanted to mention on the insurance binder is to make sure that you keep a log of everyone you talked to and what they said and the day and time that you spoke with them. And if anyone is assisting you in dealing with your insurance issues, make sure that they also follow that same protocol in carrying forward everyone that you're working with on taking care of the situation. The third binder is the caregiver binder. And Terry, you know this, we've both dealt with intergenerational homes and we're all part of the sandwich generation. It is so important in the caregiver binder to have the information on everyone within that family. And I would also add to that, and along with your children's schedules and things like that, your pet. Make sure someone has a key to get into the home. If something comes up and you're delayed medically, they can walk your pet for you and has all the instructions. And on your household binder, which is the 4th binder, please, please have a locator list in that binder. You need to know, or whoever's in your home needs to know where the circuit breaker is, the information on your alarm system, emergency, plumbers, electricians, handymen, where's your battery, your flashlight, your first aid kit, toilet paper, you get it. All of the things on that locator list.
Thank you, Debbie. Now we're going to move on to Carolanne. And Carolanne, you say there is even more a patient may need beyond the binder.
Yes, definitely. So you can use traditional household items to keep your supplies organized. So if you're on tube feeds or have IVs, anything like that, this is going to be super useful if you have a lot of medical supplies. As an example, I use a rolling cart with multiple drawers to organize and store my tube feed supplies. I also keep all my medicine together in my nightstand, so it's all in one place. That way I can't misplace it or lose it. You can also use bins to place in your closet or in your bathroom if you don't have quite as much medical supplies as I do. But make sure you try to keep everything in one spot if possible. And like Debbie said, note it in your binder so everyone else will know where these things are in case you need assistance.
Great.
And also, you might find having a medical alert bracelet useful. There's tons of different styles. I recommend using lawrencehope.com, or you can search for some on Etsy. There are a lot of great ones out there. There's more affordable ones on Etsy. Lawrence Hope can get like a little pricey, but you can make sure to list your allergies and an emergency contact on the bracelet in addition to what type of illness you have. Because God forbid if anything happened, that important info would be right there on your wrist.
Great, absolutely. Now that is a lot of stuff to think about. And I was just thinking maybe we should think about a new business here, gift registries and wish lists for chronically ill patients. I'm not so sure that that wouldn't be such a terrible idea given how many things that I know many of the patients that we talk to deal with, and you yourself, Carolanne. So, Debbie, we'll be moving on to the question section.
I'd like to really stress the importance of writing all of your questions down, but making 2 copies. one, when you go to the appointment, hand one to your doctor and make sure he answers all your questions, but keep the other copy and write down everything the doctor says and keep those questions and put them in a binder or whatever way you want to keep them, but keep them so you can refer to them.
Absolutely. That's such a great idea, because I know so many times you think of questions while you're doing other things, and then they completely go out the window if you don't have them written down somewhere.
Oh, so true, Terry.
And that segues into our note taking, which is also really important.
It's always wonderful if you can have a buddy with you, have an advocate with you, but we both know sometimes that's not possible. So again, it applies, this is your appointment, it's your time with the doctor, and just make sure you get all the notes and keep them.
Definitely. Now, Carolanne, you have a lot of great advice for us on how we can use our phone to help us in these situations.
Yes. First, I do want to mention, as great as phones are, and we normally carry them everywhere, it won't replace your hard copies in your binder. So make sure you still keep those. But it can be a very helpful tool. Your phone may have an app called Health or something similar on it. Take advantage of it. It's an easy place to store your emergency contacts, doctors' names and numbers, your pharmacy, what kind of medication you're on, the dosage, what you're allergic to, your blood type, literally everything you can think of. And that's very, very helpful information to have on hand with you wherever you go. Or if you have a quick question, you can't open your binder, it's right there on your phone. You're 2 taps away.
And with all the synchronizing we do these days, what's your recommendation here?
Yes, so I recommend using your phone's calendar. I love my Google Calendar to keep yourself and others up to date on what's going on health-wise. So you can input appointments, surgery, and more. You can also set the calendar to alert you of upcoming events, which is very helpful if you have memory issues like I do. Brain fog, for most of us, is a very real thing. So having those reminders pop up is great. And also, if your caregivers are synced with your calendar as well, you can just send or set up the appointment or surgery date, add the guests, and it'll send it right to both of your phones, which is so helpful. That's
great. Now, as a quick review, because we do have 4 sections here that we'll be going through. This is our review, a quick review of Module 1, which is get your binders and make a good user manual for yourself. Use your logs, whatever logs work for you, to keep track of the vital information for your doctors and your care team. Have an organization system at home, like bins or baskets or a cart for the hardware, the papers, and all of the things you're going to need so that you can access them whenever you need them. Always have your meds with you and your notebook. And be a good note taker. Do not leave a doctor's visit before getting all your questions answered, if at all possible, and just keep writing stuff down. I'm not sure. I'll look to Olivia. Do we have any questions? Nope. Okay. Moving on. Module 2, we're going to talk a little bit more. We're going to talk about information about yourself. In the last section, we talked about how we organize, the tools we need for organizing. Now we're going to talk about the information that you need to input about you. And we're going to start off, I'm going to let Debbie take it away here because she's so knowledgeable about this, about your rights in your medical records.
It's important for everyone to know that the HIPAA rules are there to protect your privacy. However, it's important to always remember that these are your medical records. And when you get copies of your medical records, you own them and you can control and decide who you choose to share it with.
Wow, that's so true. They're your records and you can share them. So important to know and for patients to understand. And what about accessing medical, or what about the patient portals?
Okay, I'm so glad you asked this. Let me give you a quick rundown on how we personally did it, okay? So my husband, Ken, has a chronic medical condition called CIDP, and he also has prostate cancer. He realized that we had the information on 12 different patient portals. So what we did was we downloaded and printed all of the pertinent information, then we scanned and we uploaded everything into our secure digital life cloud. So we created our lifetime health record, and it's in chronological order. Now it's so easy because we can continue to update, and we have it 24/7 for any medical appointment that comes up or any emergency. So bottom line, you can access your patient portals. You get a code, you can get in, you can download whatever you need to get. You own it, you can have it. And I really feel that if you have it and you can coordinate it in a chronological order, you're ready for anything and you're always up to date.
That's so true. I can't tell you how many times cloud services and cloud saving of important documents has saved me all over the place. Not just medically, but for other things as well. Now, Carolanne, do you have anything to add to that about accessing medical records?
Yeah, so the patient portals can be very helpful. You can make appointments, schedule tests, message your doctor with questions. You can ask for medication refills and more. So make sure you take advantage of that if your doctor does offer that as an option. They're really important to sign up for, and it's saved me countless phone calls and lots of energy just making it just like a little type away.
That's great. So what about, Debbie, what about requesting copies of our medical records as far as in writing? Is there what fees are involved, and how does that work? Because I know that you probably had to do quite a bit of that.
When you want to sign up for the patient portal, there's no cost on that electronically. You set up your system and you're in. When you want to get printed records, they usually will charge you something. But I wanted to share a very important thing here. Don't assume that your old records will always be there. Because a dear friend of ours needed to get a hold of one of his older doctors from years back, and one doctor had retired and the office was closed, another doctor died, and there were no records available there either. So for anybody here who isn't on the current system, go back to your original doctors. If your parents had records at older doctors, don't assume the records are there. Try to get copies of everything early on.
Absolutely. I totally agree. And one of the things that I'm going to add here really quickly, because we have had quite a bit of this next slide, which is making changes to medical records. And we've helped quite a few patients with this at Patients Rising through our Ask Access email address and hotline, which is, being able to, what if your name is wrong? What if one doctor, like my name is Teresa Merrill Wilcox, my birth name, my middle name was Louise, and I have all kinds of versions of my name out there in the world that are, were correct at one point or another in my life. Now, Debbie, I kind of want to toss this off to you here because you gave such a great, when we were sort of discussing everything yesterday, you mentioned a way that you have saved yourself with this, having your name spelled different ways or different last names or middle names or initials, yes, or no initial. What is that?
Thank you for bringing that up. I actually went to my attorney and he created an affidavit of names, a notarized affidavit of names. And it is such a help because you could have your nickname, a married name. You need to have proof that you are that same person. And not only is it a huge help with medical records and access to things, but it actually came in very handy at the airport. I do recommend you having that if you have multiple names.
Yeah, I've had that happen before, my ticket being made in the wrong name. Somebody else made the reservation, like they just would put Terry, which is not what any of my IDs say. It's so true.
But the affidavit of names will really make it easy when you have to navigate anything involving insurance and medical, and it doesn't match the exact spelling and things like that.
That's such a great idea. That's such a great bit of information. Thank you, Debbie. Now, Carolanne, I'm going to move on to you here. We're going to segue into understanding your diagnosis. And I heard from Olivia, who is here in the office with me, that there is a question or two out there, which we will do a quick question or take a question at the end of this particular section. So just hang in there and feel free to keep asking. But Carolanne, what about understanding your diagnosis?
Okay, so I think the most important thing that I can stress about this is don't always trust Google. Don't run to Google and Google your symptoms or your illness, because sometimes you're going to get really unreliable, scary information that you're not going to know what to do with. I think any of your doctors would agree Google might not be the best place, so try to find some reliable sources. We have some listed on the slideshow right there for you. But try to use also organizations like Patients Rising or organizations that solely deal with your illness, and you can join support groups to make contacts with other people who share your illness, and finding out others' experiences with your illness will help give you a better expectation of what to expect in your day-to-day life with your new illness that you'll be dealing with.
Yeah, that's really great. And as far as Patients Rising goes, feel free to always send us a question at askaccess@patientsrising.org if you want to find out like the best information or where we might send you for advocacy help, because oftentimes we have a lot of organizations that we work with that are disease specific or organizations that just focus on, helping patient navigation or whatever your issue may be. And we're always happy to direct you in that way if you're feeling overwhelmed, which I know the internet can definitely be. Now, another thing about understanding your diagnosis, I'm going to let you continue here, Carolanne. I didn't mean to interrupt, but I just wanted to kind of interject that.
Oh, no, definitely. So again, your doctor and other people with your illness are probably going to be your best sources for information. You can ask them the type of questions that you need to know, like what are the short and long-term expectations? Is it degenerative? Are there periods of remissions? Any kind of questions you have to ask your doctor, and other people who have gone through your scenario are going to be the experts in it. And also, I just wanted to take a quick second to mention rxlist.com. It is a great source to check all of your medications just in case there's any interactions, because sometimes doctors miss things, sometimes pharmacists miss things. So if you're going to be starting any new medications, even over-the-counter medications, I'd always recommend to put those into this website to see if there's any type of interactions before you're taking them together.
That's really great information, Carolanne. Thank you. And check out, finally, we sort of already said this, understanding your diagnosis, the best resource to your fellow patients, and check out support organizations, definitely. Now, Debbie, we're going to move into your medical history, which I know you're is long for you and for many of you.
But I did forget to add something previously when we were talking about the ability to get copies of all your medical records. I wanted to mention also that I go to the radiology department and I fill out the application there, and I always get copies of scans and CDs as well. And the way it seems to work is that I get one free, and then I always get two, and the second one I pay $10 for. So I have in the binder, in one of the little plastic holders, every CD and every scan, and they're invaluable to look back on to be able to see the baseline and then see how it's progressing. So I just wanted to make sure I threw that in there along with the other. And then in terms of medical history, it's so important to involve your family and have conversations with them about their health as well. Your family history is vital. In fact, one of the gifts that you're giving out afterward has the ability to do that in the life story interview. But you have to know the family's health history to be able to be on top of your own. And as we go in, I think this goes in on the next slide.
Yes. There you go.
In addition to the family history, we are so blessed today because of the information that we are able to obtain from genetic testing, and to be able to share.
To be able to share.
And I wanted to say that I lost my grandmother, my mother, and my sister in their 50s. And thanks to genetics testing, it saved my life. And it's the only reason that I became so assertive that I found my cancer early, because I demanded an MRI because I was very high risk with the BRCA gene. So everyone, the genetic testing empowers us to be proactive and get your family health histories.
Thank you so much, Debbie. So important. Let's do a quick review of Module 2, which is Know Your Rights under HIPAA. You can request copies of your medical records, sign up for all your portals at your doctor's offices that have them, which is so many of them now. I know most all of mine do. If there are errors in your record, you can make written requests to have them corrected. Be selective when researching your condition online so you don't scare yourself and others that love you. Rely on your fellow patients and support community, and having an accurate medical history is so important. And all of what Debbie said about genetics, it's only going to get more important. And here we are. This is our section where we're going to have a 30-second stretch, and I'm going to take a quick question. Olivia.
Michelle West asks, I have a question about hard copies of something like an MRI.
Oh, I think Debbie sort of talked about this, but Debbie, I want to let you, what can you tell Michelle about hard copies of something like an MRI?
Okay, I'll give you a prime example. I went to the radiology department and I was able to get my husband's original CD, when they were trying to figure out what was going on or any possibility of the prostate cancer. I kept it. And then later on, I went back again when he was tested again. And also, they will give you the copy. It takes about a half hour after they've, finished it. You can also get the written report, as well as the actual CD. Anyway, bottom line, when they did his biopsies, I handed the doctor that was doing the biopsy the original CD that I had, and he gave my husband, he was doing 13 biopsies, but because I gave him the one that had that crazy original spot, he used it. And Terry, it was the 14th biopsy. It was the one that showed on that original CD that was malignant. He would have had a clean bill of health. So
what an amazing story. Thank you so much for sharing that, Debbie, and thanks for the question, Michelle. Now we're going to move in to Module 3, and I'm going to try to speed it along. I know that we just have so much information here, and it's all really useful information, but I also don't want to, I know many of you have a life, and we so are appreciative that you're joining us tonight and hope you're getting some good information out of this. We're going to open up on this third section here, talking about your doctor and your relationship with your doctor. Debbie, I know you have a lot to say.
One quick tip.
Okay.
Avoid frustration by asking your doctor, what is the best way you want me to communicate with you? So for instance, one of my daughters communicates with her doctor by email. Another one actually will text back and forth. Some doctors you cannot do that with. Ask, what is the method? So he's not or she's not frustrated and you are not. Everyone has a different method that they use.
That's great. This is all really great information. So what questions, and this is obviously going to be based on the patient, but what questions should you ask your doctor? What are some key questions? Maybe just give us a couple that you would recommend right off the bat. And you did just have a great one. How's the best way for me to communicate with you?
Yes, so there's many different, things that you should be asking your doctor depending on your illness, as you said, Terry. But I would focus on a few things. I would ask about, what kind of treatments are available, what kind of medications are going to be recommended. And I think we will have a few examples as questions on one of our next slide. But just remember, when you're asking questions to your doctor, this is your time. You're paying for this visit. You're in charge. The doctor is working for you. So make sure that they are answering every single one of your questions. It's very important. So don't feel shy about asking a whole list of questions if you have them.
Thank you so much. And here's a quick sort of clockwise, I'm going to kick it off with insurance because that is one of the first things we all know that you need to check, and it's one of our most asked topics at Patients Rising. Do they take my insurance? Is it in my network? Is there a prior authorization I need for things? What testing might I need? I mean, there are just a million questions just about the insurance alone. And Carolanne, what about some treatment questions? I mean, we can sort of just tag team off of this.
Just figure out what your goal is. Is the goal a cure, or do you need to focus on symptom management? Does this plan include new treatments and medications? If so, what are the side effects, or are there any alternatives to traditional avenues to take with your illness or disease?
And what about where you're treated, Debbie? What about care locations?
It's funny, the first thing we did when we moved out here, Terry, was we found the closest and best emergency hospital here where we would go. Then we made sure that all of our doctors had privileges there and that all of them accepted our insurance.
So true. And Carolanne, what about if there's what changes that you need to make? Or
two major changes are going to be like lifestyle, including diet, nutrition, and any of your current medications. So you need to alter your diet. So for some people with GI issues, especially gastroparesis, which is the illness I have, they're told to follow a low FODMAP diet. Are there any current medications that may interact with your new treatment plan? If so, can you eliminate or change them? You'll need to figure this out, obviously, with your doctors, but hopefully you can get those questions answered so you're on the best regimen that you can be.
That's great. And Debbie, what about clinical trials?
Usually your doctor and the hospitals will have information on clinical trials, but you can also go to the website clinicaltrials.gov, which has many, many, many trials.
Yeah, many things. You can put just about anything in there and find out where in the world it's being studied and ask your doctor about it. Okay, Debbie, what about finalizing your doctor's visit notes? What recommendations do you have here?
The one thing I wanted to add is I know that you've given your doctor all the questions and you've got your copy. Don't worry if you leave and you come up with more. Just start writing out a new list. And the main thing is get it out of your head and onto a piece of paper. And you can always call the nurse, call the doctor's office, send it in, just put it in writing.
Absolutely. And so, Debbie, what about delegating? What about learning to delegate? I've talked to a lot of patients about this, and it's so important because you're so overwhelmed in many instances.
I have two things I want to share. Quickly, the thing that I did for my sister was so helpful because as soon as you are busy with treatments and surgeries or medical issues, you get clutter. So I got her baskets with handles, and I got her a bookcase, and those baskets, I sat with her on the bed, and we actually labeled the baskets that would be the place that would organize her and help people help her. So for instance, we quickly labeled mail that came in, her work papers, things that needed to be scanned, a basket of things for filing, and it was portable, so you could take it in the kitchen, have it in bed with you, take it to the couch. But the thing is, when people would come over, they'd say, how can I help? We could literally say, okay, take this basket and help scan, take this basket and go do something else. And it really is a great way to keep everything organized and hand it over to people to help you when they come for a visit. And one other quick thing, and Tara, you and I had mentioned this once, when you can create a caregiver wheel, just make a circle like you would a bike wheel, and make little spokes on it, you know, the lines, and on it, you know, make a list of people that you can turn to. People really want to help, and they'll say to you, what can I do to help? Be specific. And things like, oh, when you go to the market, do you think you could pick up the following for me? Do you think you could cover for me on my kid's carpool while I'm, you know, having a treatment? Could you come over and walk the dog for me? A group of friends, could you chip in together and get me a cleaning girl, a house cleaning crew to come in once a month? Or gift cards to a restaurant that will deliver. Make a wheel with your friends and the people you know, and allow them the opportunity to help you. No one will get burnt out because you're not giving it all to one person.
That's true. Carolanne, do you have anything to add here for this?
Yeah, I just wanted to say that the person, you should always pinpoint one person in your immediate circle to be kind of your main advocate. And this person should really be the one person who gets it, quote unquote, you know, that understands what you're going through. They can be in charge of keeping everyone else in your family and friend group up to date on your health, so you don't have to overexhaust yourself repeating things that can be hard to talk about. So I think that's very important to mention.
Absolutely. So your family and friends, Carolanne, how do we talk to our family and friends?
Okay, so be honest, be selective, be accepting, and be prepared. If you're in pain or at your body's limitations, you need to speak up. You need to be completely transparent with the people that you surround yourself with. This is super imperative. So that they can better understand what you're going through and be there to support you. But also remember, not everyone needs to know every little detail about every little thing. So again, use your one selective advocate to tell people the basics, and they can use their discretion on how much or how little to tell certain people. Your loved ones want to help you and want to understand your illness, so don't feel like you're being a burden when you're asking for help, which is really important. Everyone needs to ask for help when they need it. The people you surround yourself with will want to help you and know what they can do to be supportive, so allow them to do so. And finally, don't be surprised if you lose some friends or relationships change during this journey with chronic illness. Not everyone will get it, and that's okay. So make sure you spend your energy and your time fostering and nourishing relationships that matter.
That's so important and so true. As we kind of close out our third module here, I'm going to talk a little bit about legal authority. I've actually had to use both of these things lately, power of attorney and living will. I'm just going to take a quick segue because we're going to be segueing into our last module, which is going to be with Whitney from LegalZoom. And LegalZoom is our partner. They have a service called Life Plan, which we have been given the opportunity to offer as part of our sustaining memberships. Just for the record, as a nonprofit organization, we do not do walks, we do not do galas, we do not have auctions. Our membership is the only fundraising we do. And obviously Life Plan is not the only way to get the power of attorney or a living will, but by registering for a free membership, you do get the opportunity to try Life Plan for a few months, and we hope you'll consider that going forward in your engagement with Patients Rising. And now, quick review of Module 3 before we move in to the final finances section, which I know is everybody's favorite part. Your doctor is the chief of your medical team. The doctor-patient relationship is the most important relationship as far as your treatment and care plan. Be prepared for doctor's visits. Bring your questions. Figure out how to talk to your doctor. Get second opinions. Create a list of your chores and delegate them. Establish who your advocate caregiver team is and be open, as open as you want to be or as open as you think they are capable of handling with your family and friends. And here we are heading into our final module, finances. And Whitney, I am going to let you take it from here. Dealing with insurance is a full-time job. Rather than trying to fit it all in here, we are going to have an insurance primer, just so you know. It'll be available for download on the Patients Rising University website. Please look for our emails follow-ups after this webinar, because we will have a lot of materials and information to give you with Debbie's website and Carolanne's website, so you can keep in touch and engage with all of us with further questions. And Whitney is the principal financial planner with our partners at LegalZoom, and Welcome, Whitney.
Thank you so much, Terry. I'm really excited to be here. Thanks for everyone for joining. I just want to start by talking generally about managing your finances. I think managing your finances is hard and complex on its own. And then when you start to pile in the complexities that come along with managing a chronic illness, it can become even more challenging. So just right off the gate, I want to acknowledge and I want to address some of the challenges that really come along with managing your finances with chronic illness. So first and foremost, unpredictable medical expenses coupled with unknown needs for the future. So you go along, you're living your life, you get a diagnosis, and everything changes. We don't know what our future medical expenses are going to be. We don't know how our condition will progress over time. Secondly, when this happens, your whole perspective on life could potentially change. So you might start thinking about things that become more important to you. I loved listening to Debby and Carolanne talk about things like your nutrition might change, your expenses, your goals need to be reevaluated, resized, and have a longer horizon, or may have a longer horizon to achievement. Another thing that becomes more complex is tax considerations around new income sources if you start taking Social Security or disability, as well as expenses that now become tax deductible because they turn into medical expenses. And lastly, chronic illness is astronomically expensive and it may drain your finances and or lead to high debt. So we just want to acknowledge that and start to think of action items that we can take in relation to these challenges. Okay, so let's look at challenge number one, unpredictable medical expenses coupled with unknown needs for the future. So nobody likes to budget, right? It's not a fun exercise to do. But the first step when you're looking at these unpredictable medical expenses is to begin with learning your medical insurance plan. So the more you know your plan, the better you'll be able to predict your out-of-pocket expenses that come along with your condition. Two is, I love some of the things that we were talking about earlier with Debby and Carolanne, but really learning the likely trajectory of your condition. This can help the conversations that you have with your financial planner about what to expect and what could potentially come next. There are a lot of things that could potentially impact your financial situation, like if you take short-term disability, or if you retire early, or if your spouse ends up taking off work to support you. But these are all things that the more we know about your condition, the more we can actually plan and help you get through this complex and challenging time. Lastly, we had so much good advice around how to get organized and how to keep a record system. And this not only will help you navigate the medical complexities of your life, but also the financial complexities of your life. So what I want to do is I want to walk you through the most simple care budget that I can come up with. So first, I suggest breaking your finances into 3 categories. The first category we will look at is your month-to-month commitments. So your month-to-month commitments are the things that you're required to pay on a monthly basis, regardless if you leave your house. So think your bills, your fixed expenses, your car payment, your insurance, those types of things that you know they're coming. So that's category number 1. Category number 2 is your day-to-day habits. So these are the things like going out to eat, food that you might need to buy, gas, transportation, anything that you use on a monthly basis to support your daily life. And lastly, I suggest your third category be your care cost. So this is the estimated monthly care costs for your illness. So I know that it can be really challenging if you're thinking, what are the estimated care costs for my illness? I don't even know what's going to be happening with me in the next three years. I suggest taking this at 6 months to a year at a time, no more than that. So coming up with some of the expenses that you expect to afford and have to pay for given your new illness. So some quick hacks around this that can make things a little bit easier for you our automatic bill pay. So we want to give you the ability to spend most of your time taking care of yourself, not thinking about your finances. So setting up automatic bill pay is one less thing that you have to worry about. Secondly, consolidate your accounts. So if you have a bunch of things in a bunch of places, that could lead to unnecessary complexity. So trying to get things in one place, nice and organized, can be really helpful. And uploading all of your important documents to a vault. So organization is your friend right now. It is getting all of your important documents in the same place can help you, just like I said, focus on yourself. Another quick tip that is not on here, but I would love to talk about, is with each of your different categories, so those month-to-month commitments, those day-to-day habits, those care costs, consider opening a checking account for each of those buckets. So one checking account dedicated specifically to your bills, the things you know you got to pay. One checking account dedicated specifically to your daily expenses for food and gas and things like that. And then a third checking account dedicated to your care cost. I know there can be some variability around the day-to-day and the care cost, but the goal will be to put a certain amount of money in there, at least in the day-to-day habits, to help you become more mindful and more connected to the money that you're spending and the budget that you're setting for yourself.
Yeah, that's great. And Whitney, another thing that I would add in here too, when you're talking about a care account per se, some people do have HSAs, and those are linked to certain things which they can also use if they have one. That could also act as their care account for expenses that they can use there.
Yeah, Terry, that's a great point. Thinking about an HSA as a care account is a great idea, because HSAs give you triple tax savings, which basically means tax-free on the way in, tax-free growth, and tax-free on the way out. So HSAs, as long as you use the money for qualified medical expenses. So that could be a great idea to house your care budget.
Definitely.
All right, challenge number 2. Each income source and expense requires new tax considerations. So you might start taking on new kinds of income, disability income, Social Security. If you're continuing to work, you may also have your W-2 income. And each of these incomes come with different tax considerations. Additionally, you have new medical expenses that in the past may not have been perceived as a medical expense deduction, but now with your chronic illness, it could be perceived as a medical expense deduction. So the action here is to make sure that you meet with the CPA who specializes with working in clients and the family of clients suffering from a chronic illness. Having someone with a background and expertise in this can really help you take advantage of some of the deductions that you potentially didn't know existed.
Absolutely. I can chime in there from firsthand experience. Back in 2012, my husband and I got almost $80,000 in medical expenses for deduction. And it was, it definitely saved us for a couple of years, actually. So it's definitely, if you do rack up a lot of expenses, whether you're, in our case, some of it was on credit and all kinds of things, but we did rack it up, and it was very helpful to have those deductions and to work with a tax professional on that.
Yeah, I think a lot of people, thanks for mentioning that, Terry. I think a lot of people don't realize that your number one expense is taxes. 20 to 40% of every dollar that you make, including your disability income, W-2 income, goes to the government. So we want to make sure that you're working with a good CPA to get to deduct as much as you can. Okay, so the third challenge, your financial goals and life goals may need to be reevaluated, resized, or have a longer horizon to achievement. So when you are diagnosed with a chronic illness, a lot of things may change for you, including your perception of your future life. You may have had goals in the past that maybe aren't important to you anymore, or maybe you would feel equally as fulfilled if you could do a partial contribution instead of a full contribution. I think planning for the future around your finances and your goals is something that people have to check in on all the time, and often have to reevaluate all the time. So the action here is, if you are not already, consider working with a financial advisor who can adjust your financial plan and help you model different scenarios. And what I mean by that is, you could ask a financial planner to show you what different things could look like for you. Okay, what if I'm unable to work at age 55, or what if my spouse decides to retire early to help support me in my illness? What could that look like for me in the future? And you could get a good idea and at least have some peace of mind and clarity as to what the financial future may hold for you. And lastly, chronic illness is very expensive, and it may drain your finances. So a couple tips here are to cut costs when possible. If it's possible, generic drugs. Additionally, review your Medicare Part D plan to see if the prescriptions that you're taking are covered by the plan you're on. And if they're not covered by the plan you're on, see if there's a different tier of a plan that you could enroll in that would cover your medications in the event that they're expensive. Search foundations, drug companies, and states for programs to help with any out-of-pocket expenses. Also, check for errors on your medical bills. Look for duplicate items, services you didn't receive, services you don't recognize, and charges that your insurance may have covered. You want to review these bills. There are a lot of times there are errors here. So making sure to check your medical bills for accuracy, it could be something that could end up saving you money in the long run. In the event that you've exhausted option A and B, start working with your debtors directly to negotiate your bill or create a payment plan. Don't wait until your bill is delinquent or in collections to do this, because that's when it can negatively impact your credit score. It's best to, if you see a bill that is coming in, go ahead and talk to someone as soon as you can. Some strategies for justifying. Go ahead.
Oh no, I think that was just some feedback, Whitney, I think.
Oh, okay. Okay. A strategy to justify lower charges is to compare the price you were billed to average fair price charged by other providers. You can use websites such as New Choice Health or Healthcare Blue Book to get an idea of what you should be paying for some of these expenses. Also, if you have health insurance, visit your insurance website. You might be able to look at estimated costs through the website directly. Lastly, work with a medical caseworker, debt negotiator, or medical billing advocate to help you in this process. So medical billing advocates are insurance agents, nurses, lawyers, and healthcare administrators, and they can help decipher and lower your bills. Lastly, discuss bankruptcy as a final option with a legal professional. Bankruptcy is in the event that you are overwhelmed, inundated, can't keep up with minimum payments. It could be an option to help relieve you of some of the stress that comes along with high medical bills. There are plenty of people that do go through the bankruptcy process and end up improving their credit and end up living a financially well life in the future. So if bankruptcy could be an option for you, it's not the end of the world by any means. There are plenty of people who have bounced back from that. So the action here is explore your options and ask for help. If you are in financial distress, explore these options and begin to ask for help when necessary.
That is so true. And I know so many people who have been through bankruptcy, and they are on the other side of it for various reasons, not just from medical.
Yes.
But thank you for all of that great information. And now that is the end, that was a lot of information. And thank you all for hanging in there. And what we're going to do real quick, I'm not sure. I saw some people like raising their hands, and I'm not really monitoring all of that. So I'm going to turn around and find out if we have any questions or anything we need.
We have one question. It's from an anonymous person, but it's for Debbie. How did you think of your 3 Gs?
Oh, so Debbie, did you hear that?
Yes, I did.
Okay.
I was thinking about a method that would apply to just about everything I did, and I wanted it to be simple. So I realized that every situation started with being informed. And then I realized that once informed, you absolutely have to be organized to accomplish what you need to do. So those two together made me realize that once you're informed and once you're organized, you can take actions and feel secure that they're based on good logic and you can implement it. So I came up with that, and I have it on my refrigerator and I have it on my desk and I live by it. And I find that it applies to most things in our lives. Thank you for asking.
Thank you, Debbie. Anything else?
We're gonna help. I have Diane Talbert talk in a second, actually.
Okay, we have somebody who will be talking. Diane Talbert, who is also one of our patient advocates, I believe.
Oh.
No?
No.
Not going to happen. Okay, I'm not sure. So here we are at 7:56. I thank you all for joining us. In closing, I would like to thank our panelists, Debbie, Carolanne, and Whitney, and all of you out there for joining our inaugural webinar. They will get better. And next month, we're going to be doing one on strictly financial navigation of the healthcare system, because we could have done a whole 45 minutes just on that. I know we could have. We just sort of touched on it at the end with Whitney, and she gives a lot of great information, but we will be diving into that deeper next month, because that is obviously, you know, on every top of everyone's mind where healthcare is concerned. So please look for follow-up emails with more information, downloads, and links. You can ask us if you think of questions afterwards, or you want something that you don't feel like we touched on. Please feel free to email us at askaccess@patientsrising.org. There are many ways that you can stay connected with us at Patients Rising. You can become a member, you can make a donation, which we would appreciate, but the membership is also free. There are ways to earn your membership by engaging with us. You can follow us on Facebook, Instagram, Twitter. @Patients Rising is how you can find us. Become one of our action advocates at the state or national level by clicking over to patientsrisingnow.org and joining us in that fight if you're interested in patient advocacy. And we would so love it if you could leave us a review on our Facebook page. And when we send out the survey, our follow-up survey on this, please let us know what you thought of the webinar, how we can make it better, things that you wish we would do. We're here to help you, and and the best way for us to learn how to do that better is by asking you to take a few minutes to share your thoughts with us. So all of this content is created for patients, by patients and caregivers, and your input and feedback is invaluable. We hope you enjoyed this inaugural webinar. Please tell your friends and share the information. And thank you so much, and have a great evening from whatever time zone you're in. Have a great night, everyone.